Hi, for our community health assessment, we decided to assess childhood obesity in Tyrrell County, North Carolina. We are Barbara Barrett, Adrienne Blanton, Angela Miller, and Victoria Tankersley. According to the National Institute for Healthcare Management, from September 2014, childhood obesity continues to be one of the largest public health crises in our nation. 1/3 of children and teens nationwide are overweight or obese, and more than half of those children become obese at or before the age of 2. Another key statistic from the NIHCM Foundation states, in North Carolina, 29% of low-income children ages 2 to 4 years attending a state-funded health clinic are overweight or obese. This is why we decided to investigate this further. Tyrrell County is very rural, and it's located in northeastern North Carolina. It is the least populated county in the state. There are many natural areas and waterways. The county is bordered to the north by the Albemarle Sound and the Scumpernong River, and to the east by the Alligator River. Tyrrell County is home to several national parks and nature preserves. Columbia is the main town located in Tyrrell County. Many people pass through the town via Highway 64 en route to the Outer Banks. The quaint downtown area is off the main road and often is missed. This area is home to local businesses, residents, and county offices. All 3 schools are located within city limits. Tyrrell County also includes precincts of Alligator, Kilkenny, Scumpernong, South Fork, and Gumneck. Tyrrell County residents are fortunate to have a few chain stores for groceries and amenities. The downtown area is home to shops and local restaurants. They also have fresh seafood retailers and farm stands for local produce when in season. Though playgrounds are hard to find, there are several national parks and preserves in the county that offer excellent places for families to get outdoors. There are miles of trails suitable for hiking and biking and public water accesses, great for boating and kayaking. Tyrrell County is also home to the Eastern 4-H Environmental Education Conference Center, one of the 3 centers operated statewide. The center offers several camp opportunities throughout the year. Tyrrell County has 3 schools: Tyrrell County Elementary, Columbia Middle School, and Columbia High School. Medical services are limited. The county health department is through a district partnership, the Martin Tyrrell Washington District Health Department. The Columbia Medical Center is also located in the downtown area. Housing varies significantly throughout the county. There are large farmhouses scattered along the country roads with smaller ranch-style houses and mobile homes mingled in between. There are also waterfront communities with various size luxury homes. Many of the residences within the town of Columbia appear to be older homes. Housing throughout the county varies significantly in age, level of maintenance, and repair. Next, we'll discuss our key informant. We decided to talk with a school nurse at Tyrrell Elementary School. It is a very small school system. Approximately 600 students are in grades pre-K to 12. Physical education class, of course, is mandatory for all elementary students. According to our nurse, there's 1 recreational sports league in the community that offers baseball, soccer, and basketball. Our school nurse was only aware of 1 public park that is located in sort of a lower income area, so she did discuss how this is not readily accessible to a lot of children. And again, she discussed how this is a high poverty county. When asked, have you noticed a greater number of overweight or obese children? She did say definitely that there is a significant amount of overweight children in her school. School offers summer feeding programs, which is a definite benefit for those children that do live in the high poverty areas. School meals follow state guidelines. However, she did talk about how oftentimes it's pizza, fried foods, and fruit drinks, which is not necessarily what children should be eating all the time. So that is a negative for the school system. She did discuss some other community resources, which include churches that donate food for those in need on the weekends. Church after school program, there's one that she knew of that's frequently used, but she didn't know of any other programs. The health department does offer a nutritionist, which could be a definite advantage for children. And as we discussed, the Eastern 4-H Center offers a yearly healthy weight clinic, but it does cost $3,000 per week. So according to our key informant, the greatest strength is support from the community, but the greatest weakness is the limited amount of outdoor play areas or affordable programs that offer regular exercise. Tyrrell, Martin, and Washington combined their district health departments for this report. 2013 State of the County Health Report. This informational report is called SOTCH, State of the County Health Report, and is completed during the years that the actual community health assessments are not completed. Listed are some of the key statistics for Tyrrell County as reported in 2013 for the year of 2012, if you want to take a look at those. In the report from North Carolina Child, How Healthy Are Tyrrell Children? On the slide are some of the facts reported. 35.7% of the children in Tyrrell County live in poverty. In addition to this, the median household income is only $34,216. Tyrrell County's profile information is provided from the North Carolina Economic Data and Site Information from the Department of Commerce called Access North Carolina. Resources for healthcare are not readily available. According to the report, there are no physicians or dentists located in the county. Nurses and pharmacists are located and can be a valuable resource for education and support. Mortality information for Tyrrell County shows some of the same causes of death as with other counties in North Carolina. Heart disease, cancer, stroke, and diabetes are the highest. Obesity and lack of exercise can increase the incidences of these chronic diseases. Education for the community is very important to improve their health and quality of life. From the North Carolina Nutrition and Physical Activity Surveillance System 2010 report, each county in the state is listed for children from the ages of 2 to 4, and they're listed from underweight, healthy weight, overweight, and obese. In this slide, we have the information for North Carolina and Tyrrell County. The neighboring county of Martin had 14.7% of their children obese, and Washington County was listed with 8.9% of their children obese. So this is a very, this is an issue in this area, as you can see by the neighboring counties. Tyrrell County recognizes the need for addressing weight control and obesity in order to prevent serious disease processes. The community health assessment referenced several factors contributing to obesity in Tyrrell County. They include poor access to free public recreational areas, limited grocery stores and restaurant choices in the area for healthy eating, and limited access to local healthcare providers. According to the National Institute for Healthcare Management, recent research indicating that lifelong health is largely determined during the formative years of early childhood points to the importance of establishing health lifestyle behaviors before children enter kindergarten. Additionally stated in the article, 34% of North Carolina children under the age of 6 years spend all or part of their days in licensed child care centers where they consume up to 2 meals and 2 snacks a day. If you look over our overall strengths and weaknesses, you will see that the community support is there, but they are mainly lacking structure and access. based on our overall assessment and weaknesses in the community, here are our diagnoses that we chose. We chose these because the community needs to improve their sedentary lifestyle, diet, and importantly, education, so the children can do the same. For primary interventions, we focused on forming partnerships in the community in order to form new programs for the children. Our secondary interventions, of course, include improved screenings to bring forward children that are at risk. And most of these would or could be conducted in the school system. For tertiary interventions, we focused on referrals and aimed for better collaboration and communication among care providers or caregivers. What we have learned from this project and what we hope to take with us in our nursing career are three things. Childhood obesity is a growing problem that requires help from parents, schools, local government, and volunteers from the community. Community nurses need to form and maintain relationships with those serving the community to be effective. And collaboration is key in making change in a community. Here are our references listed. Thank you.